There's a trend for people to name a sign or a symptom and declare it as if it's their diagnosis. And I think people do this because a lot of American doctors put forward this idea that people have something, but it's not really the diagnosis. For example, do you have hypertension, or do you have an underlying problem that's causing you to have high blood pressure? The number one example in orthopedics, of course, is low back pain. People have low back pain. And of course they do, but that's not helpful. We need to figure out what's causing the low back pain and address that. And if you're someone who just wants to address the pain, that's your decision to make. But if you're not reversing the disorder, or at least attempting to reverse the disorder, it's likely going to become worse over time, create other disorders, and create more symptoms in that area or in other areas down the line. But another term that people use kind of diagnostically when I think it's too vague is instability. And instability can come from myriad things. Ligament ruptures or ligament sprains, for example, can be one cause of instability. Ligaments, after all, are structures, are tissues, connective tissues, that connect different parts of bones, different bones as well, in a joint. And so if that's not there to provide that structure, then you can have an unstable joint. But instability can be caused by lots of other things. A dislocated shoulder, for example, is unstable. A fracture in a joint line is going to be unstable. Even a muscle lesion near a joint in the initial phases of the strain can create a feeling of instability. Mechanical joint derangements can also create instability. Instability is when the patient's noting that it just doesn't feel stable or firm. And I definitely hear that with people who have, for example, mechanical joint derangements in their low back. Sometimes their lower extremity will feel unstable. So if you want to classify your problem as instability, I don't think you're going far enough. You have to identify, well, is it a ligament sprain? Is it a local muscle strain? Is it maybe even a tendinopathy? Is it a mechanical joint derangement? Is it a fracture, etc.? You need to find the underlying cause and address that. If you, for example, just thought of instability as something you could train by doing more stability exercises, you may achieve some results, but I think you're missing the main point. You have to fix what the problem was. And then if the instability remains after you've addressed the underlying cause, you can do exercises or rehab protocols, for example, that would increase that inherent stability. That proprioception maybe is deficient. But there's a slew of other kind of signs and symptoms that people think are diagnostic. Poor balance is not diagnostic. We don't know why you're having such a hard time with your balance. It could be something in your brain. It could be something like another thing that causes instability. It could be something that has to do with the inability to feel, the sensation in the foot is off. You have to identify why balance is poor and then address that. Like I said, there's a slew of these things, but I really challenge people to not use kind of these vague terms or use terms that represent signs and symptoms, things that the patient notices or feels, or things that can be measured in a clinical or imaging kind of paradigm. Don't use those things necessarily as a diagnosis, because you want to have something that you can identify as the real problem and go after that.